Hi, this is Dr. Daljeet Kaur. I'm a consultant psychiatrist and I'm the founder of HealthyMinds. As you know, we've been doing various videos on different topics, and today I'm going to talk to you about bipolar disorder. What is bipolar disorder? Bipolar disorder is a severe and enduring mental health condition that affects your moods. Your moods can swing from one to the other. You must have heard of people talking about, I feel really high, manic, and other times I feel depressed. In fact, many of them come to me, just after reading Google and all, and they want to know, are they bipolar? So I want to explain to you properly what is bipolar. Just having few mood swings is not bipolar. Let us understand what are the symptoms of bipolar. People with bipolar disorder have different episodes of either mania, hypomania, or depression. You might have also heard about different types of bipolar. People talk about bipolar 1, bipolar 2, rapid cycling bipolar, mixed bipolar disorder. Well, we're not going to talk about all, but let me explain to you. When you talk about bipolar 1, it basically means you're having a manic episode. What is mania? Well, mania is a time where you've got like 7 days or so at a stretch where you feel really high, really elated, you're full on energy, you want to be doing lots of things, you don't feel the need to sleep, you can feel really grandiose, you feel you have some special powers. People want to gamble, people want to overspend, they want to buy companies, they want to buy horses, they want to do things that are out of their character. And it's so sad that people don't actually realize at the time that they're doing all these things. People can be sexually disinhibited as well, they can make advances towards others, they can have flights of idea, their speech might be about just jumping from one topic to the other. There's also something called pressure of speech where they just non-stop keep talking and you might not actually be making sense because the thoughts just jumble from one to the other. Sometimes you see a manic person really giggling and pleasantly manic. Other times it could be that a person could be really irritable and aggressive. So if someone's got these kind of symptoms for 7 constant days, that is called manic episode, and that would be classified as a bipolar 1. What happens in bipolar 2 is a person can have a hypomania, wherein these kind of symptoms, but not significant enough to interfere with their day-to-day lives. That means someone can be feeling a little bit irritable, a little bit high, probably not sleeping that well, but still being quite productive at work and going partying with friends and all. Often the hypomanic episodes follow a depressive episode. We all know about depression. You've probably heard about depression as unipolar depression, where depression is on its own. The symptoms in bipolar depression are also pretty similar. You'll be looking for things like a person is lacking motivation, not sleeping well or sleeping too much, either eating less or eating more. Symptoms of depression in bipolar are very similar to the ones in unipolar. You'll be looking for low mood, a person lacks motivation, probably doesn't want to get out of bed, doesn't want to do their regular chores. Their concentration is getting affected, they're not enjoying things, they can feel guilty, worthless, hopeless. At times they can also have suicidal thoughts, and some of them might actually end up attempting suicide. So what causes bipolar? We do not know the exact cause of bipolar, but there could be various reasons contributing to that. The first one is the predisposing genetic component here. If there's a family history of bipolar, you have a higher chance of getting bipolar illness. Extreme stress, overwhelming problems, life-changing events, these can actually trigger bipolar illness. So now that we know this is a bipolar illness, how do we treat it? Well, first of all, you definitely need to go to a profession when you're suspecting a bipolar illness. Once a diagnosis is made, they would be suggesting medication. Since the moods switch from one to the other, it is very important for a person with bipolar disorder to have their mood stable. Hence, mood stabilizers would be used. Sometimes bipolar disorder can also present with psychotic symptoms like hallucinations or false beliefs, and in those times, antipsychotics could be used. To contain a manic episode, it might be required that the person has to get admitted to a hospital. Other times, it could be managed at home with a medication. And when it is a depressive phase, very often it is managed at home. Now, how much of antidepressant is to be used so that it doesn't switch you from depression into mania, and what kind of mood stabilizers have to be used? These are all things that a psychiatrist will guide you through. Therefore, a regular monitoring with a psychiatrist for anyone with bipolar is utmost important. Psychological treatment like talking therapy can also be of use. It can actually help you build relationships, it can help you with your depressive episodes, it can give you some relapse prevention techniques. You could learn about relapse prevention techniques so that you understand your warning signs of illness and an action is taken at the right time. I hope you found this information helpful. Should you wish to hear similar kind of topics, please write to us and we'll be happy to make more videos and create mental health awareness. Thank you.